my disease is poliomyelitis, or known as polio. Today we'll be going over the background, Otto Whitman, famous people with polio, types of polio, symptoms, treatments, experiments, discussion of experiments, acknowledgements, references. That open the floor to any questions, comments, or constructive criticism. Let's go over the vocabulary. Enterovirus are genus of positive sense single-stranded RNA viruses associated with several human mammalian diseases. Genome is the haploid set of chromosomes of an organism. Placebo is a simulated or otherwise medically infectious treatment for a disease or other medical condition intended to deceive the recipient that look just like the real vaccine. Counterintuitive, contrary to your intuition or to common sense expectations. Eradicated, to put an end to or destroy. The history of poliomyelitis. Polio is a viral disease that can affect nerve and can lead to partial or full paralyzation. It inhibits the use of your arms, legs, spinal cord, and nerves. The first outbreaks of polio happened in the 18th century. Otto Whitman discovered polio, and he was the Swedish physician who discovered it in 1907. Both Jacob Hein and Oscar Meaden wrote about this disease, but Whitman was the first one to record it. Famous people with polio. Gene Simmons, President Roosevelt, Neil Young, and Dennis Washington. This is a picture of President Roosevelt. Origin of the polio. Polio outbreaks were recorded in 1789 in England. This deadly disease frequently affects countries like Afghanistan, Pakistan, and Nigeria. Political unrest, poor health infrastructure, and government negligence are among the reasons for the high rates of polio cases. Polio cases have decreased over 99% from 1988. An estimated 350,000 cases to 230.3 reported cases today. Polioviruses. Poliovirus is the causative agent of polio. It is a human enterovirus. Poliovirus is composed of an RNA genome and a protein capsid. There are 3 types of poliovirus: type 1, type 2, and type 3. And this is a picture of the poliovirus. Types of polioviruses. Type 1 is the most virulent and common. Both Salk and Sabin vaccines are trivalent that active against all 3 virus types. Type 2 has not been detected anywhere in the world since 1999, and type 3 is just like type 1. Only type 1 and type 3 wild poliovirus continue to circulate in endemic areas. Both are highly infectious, and both are paralytic polio. Type 1 is most pervasive strain of poliovirus, and type 3 is very low levels. Symptoms. Symptoms can include abnormal sensation, breathing and swallowing difficulty, constipation, muscle pain, spasms, paralysis, nausea, vomiting, abdominal pain, and headache. This is a picture of somebody having polio. After vaccines. There are no cures for polio, but scientists are made vaccines to prevent it. There are 3 types of polio: circulating vaccine-derived poliovirus, immunodeficiency-related vaccine-derived poliovirus, and ambiguous vaccine-derived poliovirus. Circulating-derived poliovirus is used if the population is seriously under-immunized. Immunodeficiency-related vaccine-derived poliovirus is used replication of vaccine-derived viruses has not been observed in small numbers of people in rare immune disorders. And ambiguous vaccine-derived poliovirus are vaccine-derived polioviruses that are isolated from other people. This is a picture of somebody with vaccine on. Future vaccines. Over the past half-century, global use of highly effective vaccines against poliomyelitis brought this disease to the brink of elimination. Mounting evidence supports the argument that a high level of population immunity must be maintained after wild poliovirus circulation is thought to preserve a polio-free status world. Shifting factors in the risk-benefit cost equation favor the creation of new poliovirus vaccines for use in the foreseeable future. Genetically stable intubated virus strains could be developed for an improved oral poliovirus vaccine, but proving their safety and efficacy would be impractical owing to the enormous size of the clinical trials required. Novel versions of inactivated poliovirus vaccines that could be used globally should be developed. An improved inactivated poliovirus vaccine must be effective, inexpensive, and safe to manufacture and easy to administer. Combination products containing inactivated poliovirus vaccine and other protective antigens to be become routine childhood immunizations around the world. Pharmacy polio shots cost about $82. At San Francisco, polio vaccinations cost to $53. And at Baylor, Texas, a vaccine costs at least $159. For patients covered with health insurance, typical expenses include a copay of $10 before. Many people have been doing research on polio, like the people from National Foundations for Infantile Paralysis. The vaccinated second graders formed the treatment group. The first and third graders at the schools were not getting vaccinations and formed the control group. It was adapted from data and articles by Francis. There were actually two trials corresponding with two statistical designs. The original design called for vaccinations of second graders in selected schools in areas of the country with the consent of the children's parents. In the second design, children were selected again in various schools in the areas, all since parents consented to the vaccination. The sample was randomly divided into treatment and control group. Children in the treatment group were given polio vaccinations. The false report column refers to the cases that were initially reported as polio, but were later determined not to be polio. Not in the collated row refers to the children in the designated grades who did not participate in the experiment and include 8,577 children who received 1 or 2 but not 3 injections of placebo. Discussion of the first design, the treatment, and the control are different with respect at least 2 variables: age and parental consent. For vaccinations, the critical issue is whether these variables are related to the variable of interest, namely contracting polio. In the second design, parents who consented to the vaccination on average better educated and more affluent than lived in more sanitary conditions. As counterintuitive as this may seem, the children of these parents were likely more likely to contract polio. Thus, this compounding variable causes bias against the vaccine. In terms of diagnosis, the problem is that mild cases of polio resemble influenza and other common diseases. Doctors who generally believe in the value of vaccines will tend to diagnose polio slightly more often than unvaccinated children. In the control group, there are more than vaccinated children in the treatment group. My acknowledgements. My mom, my dad, my 2 sisters, brother, and stepbrother. My friends, God, Dr. Moses Williams, Dr. Charles Smith, and Mr. David Robinson. My reference list. Now I'll open the floor to any questions, comments, or constructive criticism.
You said that the type 2 virus was detected since 1999. Do you know why that is?
No, but I'll get back to that. Q?
You said there was an epidemic. I don't remember when. Can you go back to the slide?
but I'll get back to you on that.
Why do we need, so you said that there are, I think, 3 different vaccines or something like that. I can't remember the names of them, but why, would you need, yeah, those different types? Why would different people, like, what's so different about each of them that those specific people need to get those specific
It's
vaccines?
for those 3 different types of polio viruses.
So do like immunodeficient people normally get a certain type of polio?
Yes.
Or,
Like, I think you guess like type 1 and type 3.
okay. And then can you go to the experiment slide where you talk about the different columns and rows? That one. So what columns and rows are you referring to? Yeah, because I don't really see a table on there. So, like, what do these 2 bullet points mean for the experiment?
I just forgot to put the table on the back of on this slide.
Okay, so, but I'm assuming you've seen it before, so what do these 2 bullet points, like, what is that table supposed to show us?
Like the birth design, like they got like the first design where the second graders got the vaccine from. They I have to get back to you on that. So
You said one of the symptoms was paralysis, right? Is the paralysis permanent?
yes, it is.
So, after the, so